Bismillah ar-Rahman ar-Rahim, my dear candidate for MRCS exam. I would like to help you to pass this exam safely. As a rule of an examiner of the Royal College of Surgeons of England, with total respect to the code of conduct with the Royal College, I am obliged to help you to pass. So my first advice, please read the syllabus of MRCS, which is officially made by the Royal College ICBSCE, headed by Professor Amr Mohsen. So this is an important document. It has been issued in 2013 and been amended in 2018 and still valid up till now. Someone will say, well, this is too long a document for us to study. No, it is just about 40 pages, not more, but very crucial for you to put a good foundation, what you need to study and where to study from. So, number one, I would like you to draw your attention that you are being examined in 10 modules. So every station will belong to one of these modules. It's here they are. You need to study them well. And I just would like to draw your attention to one important issue, which is the transplantation. You are asked to have very good knowledge about transplantation because this is common practice in the United Kingdom. You must know about the transplantation card and preparation of patient for renal transplant, liver transplant, and heart transplant. The other issue, which is also important, is the recommended reading list. Here you will find recommended reading list that the Royal College recommend you to read, and the exam definitely will not go outside these options. It mentioned here what you need to study in anatomy and physiology and pathology. Sometimes he give you only one source to study. And like in the pathology, tumor, you need to study this well. It is not large amount of text that you need to study, but this is what the Royal College recommend for you to read, which is very, very helpful advice. Now, I will give you a very nice summary of the items that you need to study well and how the exam being formulated. So here it's actually a very nice example of the OSCE station. He give you a sheet, how the OSCE station is being done, how it is being marked, and this is not a confidential information because it is already found in the document. And he did give an example of the title, nasogastric tube and gallstone. And he always mentioned what area of knowledge he is testing, and this is applied knowledge. And the domain being assessed, you've been assessed on your professionalism, which give you 4 mark, and clinical, which give you 4 mark, and clinical knowledge, which give you 12 mark. So overall, you have 20 marks, and this is the total amount. So here it will give you when this station have entered into the exam. It was used in the MRCS exam in May 2010, and it will tell you what you will find this station. You will be asked to have it to see a chest X-ray and to see an abdominal CT scan. So there are 2 things on the desk with the examiner. Okay. Now he give you the scenario, or what is called the candidate instructions, or what sometimes candidate call it a STEM. And this you must read very, very carefully. The STEM, for example, the scenario number 1, you are called for high dependency unit to review a chest X-ray. shortly after starting your night shift. The nurse informed you that the patient was admitted with intensive care 2 days ago. Patient underwent a laparotomy for perforated viscus, sigmoid volvulus, and had 3-week stay in intensive care. So he's been admitted 2 days for perforation of viscus and he's now in ICU. Nutrition has been difficult. He's unable to eat. Earlier today, the patient nasogastric tube fell out. So the nasogastric tube has been fallen out. And the F2 doctor, which is like the house officer, was covering the high dependence unit. He replaced it. So it has been replaced by someone who is less qualified, but according to hospital policy, he's allowed to do nasogastric tube, but has now gone home. Look at the chest X-ray. So here's the scenario. You will be asked to see chest X-ray and to ask. All the OSCE station mention exactly 1 day of a doctor CT1, CT2 in UK. And this is very common practice. The nurse will ask you, can you please come doctor and have a look at the chest X-ray? Now, I did give you an example of a chest X-ray. Here it is. This is the chest X-ray that you will find in this station. And here is the nasogastric tube. You can see it is going into the right side of the patient. And here is a CT scan. And this is the same CT scan or similar to the one that you will have in the exam. Okay. Someone will say, okay, how the station will begin. You will go after reading this instruction for 1 minute. You will be asked to enter the room where the exam is being held. And the examiner will have exactly like this paper, which is called examiner marking sheet. This is where he is going to put his marks. And each domain is described as here, and here is the grade. There is no half mark, so you either give 1 mark or 2 or 3 or 4. And the Royal College have regulated exactly how many mark for each question. So here are 4 questions. You can see each question is 1 mark, and it tell you what to give the mark for. So first question, which will be asked by the examiner, exactly in the same word. He will say, describe the check that you would perform before assessing clinical aspect of this film. So before you assess the chest X-ray, you must say this is chest X-ray of patient named so, dated so, showing, and then you need to comment on the AP view and you comment on general structure. And here you must, as I said, name, date, hospital number, name above, and date of the examination. And 1 mark for all element correct. So if you mention 1 or 2 element and you forget the rest, you will get 0. Because 1 mark for all the element. Secondly, outline the system to use to assess clinical aspect of the film. And you need to describe a clear system as in the ATLS course, which is ABC. So you look in the airway, you look in the breathing, you look in circulation. If you mention that, you get 1 mark. How do you assess the projection? Now, here is a direct question, how you assess the projection. You look if there is AP and PA on the chest X-ray, and you check the scapula. Is it away from the clear lung field or not? And here you will have 1 mark. This may have been mentioned, answer question number 2, because some people will mention to check X-ray AP or PA in number 2. If he done that, he will get the mark, and then he will have been answered that question as well. Now, the last question in this domain, how do you assess whether the film is rotated or not? Obviously, you need to look at the heads of the clavicle in relation to the midline. Again, this can be mentioned here, but need to be mentioned there. So Here are 4 questions regarding chest X-ray. You can see the head of the clavicle, and the center or the midline. So this patient is centralized. So here the examiner will give you from 1 to 4 mark, it mentioned here. Now here is the second domain. And this, again, another knowledge domain. Look at the chest X-ray, nasogastric tube. Be specific in your answer. So you see, all these questions are very accurate. And you will say, found the examiner say exactly the same phrasing, which is very clear. If it is not very clear, you can ask the examiner, can you rephrase? And you're allowed to do that once. He will rephrase it once, not anymore. So, here is the ideal answer. In the right bronchial tube, the tube passes through the trachea, the right main bronchus into lobar branches. So you can see it is going into the right side, not the correct way. What clinical condition may develop as a result of feeding using this tube? It will cause definitely aspiration pneumonia. What else can you identify on the film? You can see an ECG, you can see tracheostomy tube, gas and colon cancer, there is no perforation, and so on. What are the 3 immediate action you should take in regarding this tube? So he mentioned 3 immediate action. Number 1, remove the tube. Number 2, replace the tube. Number 3, recheck its position. So you've been asked again, 1 mark for each, and here is the full mark. Now we'll go to the second page. Here is another knowledge domain about CT scan. Here are the questions. You can review them, and each one there is a mark, and it is very clear. And here is the skills domain, which you mention your skill. What are the options for the timing of surgical intervention? So here it will mention some item about the intervention for acute cholecystitis. And here again is the mark that you should have for this question. Now here you will have borderline or pass or fail. And this is not a accumulation of your grade. Sometimes you can have high grade, but you still fail. And you can have low grade, but you can pass. Let me explain it further. Sometimes there is a question that is crucial. And for example, if I tell you on this chest X-ray, this is a nasogastric tube, the nurse told you, shall I start nasogastric feeding, doctor? If your answer is yes, as if you have killed the patient. So although this is one question that you asked wrong, but it is fatal. And then you will have a fail, although you might have not a bad mark. Now pass, you can have a pass, although you can have multiple many mistakes, and even you can get maybe 12 out of 20 or 14 out of 20, but you can pass because none of them was a fatal mistake. So this is an overall assessment to the candidate, which for us as an examiner, do you like this doctor to be your CT2? Or you think he's dangerous? This is what it means. But the grade is definitely the grade. Now, nasogastric tube is not just this question. I've actually put here very important question for nasogastric tube, which is not covered by this station. I will not go through all of them, but you can mention them, read them in the video. You can stop the video and read them. And here, for example, what is the golden standard to confirm nasogastric tube placement? Is a chest X-ray. No question about it. And what are the 2 X-ray signs confirming correct nasogastric tube? The tip is below the diaphragm, tube follow midline down the esophagus. These are the 2 points. How you can know that the nasogastric tube in the stomach, or what bedside test can be used initially to check placement of nasogastric feeding, is pH testing. suggest gastric placement if the pH is less than 5.5. So with litmus paper, you can do that. So there is definitely more question for a nasogastric tube. And my advice to you, it is not important to know which station will come to you in the exam, but it is important to know the style of the MRCS exam, that you have very good knowledge and you prepared yourself for any station. And every time or every day you examine candidate, there is always one candidate which bring in nearly all stations. He get between 18 to 20. And this candidate, he did not know what station will come, but he has been well prepared and he had studied very well. And he has very good communication skill and he can pass into an station. I hope all of you will be this candidate when you go to the exam next time. So I hope with this video, I have explained to you an example which is not a secret example, but an example which is found in the syllabus, which is an example of the nasogastric tube and CT scan. And here is the CT scan. It will mention what is the arrow show. It shows multiple gallstones in the gallbladder. And sometimes we ask you, what is this aorta? What is this IVC? What is this superior mesenteric? And where is the splenic shadow? So the basics of CT scan is very important for you to know. So my advice to all candidates, study well, study 8 hours a day, and very, very important to study the syllabus, which you will find available over the internet, Guide to Intercollegiate MRCS Exam, and it has been amended 2018. I wish you all the best. My name is Dr. Muhammad Omar Farouk. I'm a consultant vascular surgeon.